Good evening, my name is Maya Martinez, and this is my informative speech on hypochondria. Hypochondria is a chronic mental health disorder that is essentially an obsession with the idea of having a serious illness but undiagnosed condition. For example, a person who has a minor cough may think that they have tuberculosis, or if they hear sounds produced by organs in the body, like growling, they see it as a serious illness. Hypochondria will typically start in your early adulthood, and oddly enough, can also show up after the person or someone they know has gone through an illness themselves, or even if they have lost someone to a serious health condition. Around 2/3 of hypochondriacs generally have a coexisting psychiatric disorder, such as obsessive-compulsive disorder, panic disorder, or depression, and even phobias. In some cases, other people are afraid of going to the doctor in general. They want to avoid any reminder of a possible illness, so they will begin to neglect their health. Signs you may be a hypochondriac are as follows: frequent visits to the doctor or avoiding the doctor, switching from doctors to doctors, fearing that any minor symptoms or body sensations can be a serious illness, avoiding areas where they can get contaminated, spending an excess amount of time diagnosing themselves with symptoms they may be feeling, finding little or no assurance from doctor visits or negative test results. In the early 18th century, the origin of the word hypochondria meant a physical disease caused by imbalances in the region that was below the rib cage. That wasn't until scientists came to realize it was much more than that. To be diagnosed as a hypochondriac, you must have experienced the symptoms for at least 6 months. These can vary from physical and mental symptoms. The most common ones are dizziness, anxiety or panic attacks, repeatedly going over thoughts, or sensation of pins and needles. The constant worrying can release harmful stress hormones and can cause real physical damage. With most mental health illnesses, unfortunately, there isn't a cure for the disorder, but it is very hard to treat, but there are also ways to maintain it. The recommended way to treat hypochondria is with therapy, not physical therapy, but counseling therapy. Cognitive behavioral therapy focuses on modifying negative thoughts, behaviors, and emotional responses associated with psychological distress. Desensitization is a psychological treatment that reduces fear and anxiety by gradually exposing the person to what they're afraid of. Some self-care techniques that are taught to the patients are stress management and relaxation techniques, verbalizing frustration, meditation, and rhythmic exercise are great ways to reduce symptoms of stress. Common drugs that have been found to ease symptoms are fluoxetine, which can treat depression, OCD, bulimia nervosa, and panic disorder. Another is paroxetine, which helps with the same things as well. The cons about taking medication is that they come with side effects, such as insomnia, headaches, vision changes, fatigue, nervousness, loss of appetite, weight changes, impatience, and many more. Drugs are known to just be a temporary fix, whereas therapy will take longer, but there is a higher chance of permanent relief. Being a hypochondriac and experiencing health anxiety can be very debilitating. It will severely affect the lives of the people who suffer from it. So it is very important that the many sufferers are willing to acknowledge the role anxiety plays in their symptoms, so that they begin to slowly get treated. This is a story about Jessica Ellis. She is a 23-year-old who has suffered with the condition for the past 3 years. She describes her diagnosis and the difficulties of living with health anxiety. She stated, "I always dislike the term hypochondria because it gives the idea that a person is just being dramatic or attention-seeking." Jessica has suffered from general anxiety disorder and OCD for as long as she can remember, but eventually turned into health anxiety. She noticed that she was urinating a lot more than normal, so she did what you're told never to do and Googled her symptoms. The results showed that it could be a UTI or diabetes. She got tested and both tests came back negative. A few days passed and she was scrolling through Facebook and saw an article called "Ovarian Cancer, the Silent Killer." As she read more and more into the article, she came across a symptom that people often ignore, which is frequent urination. She said that she went to the doctor 3 times in a span of 2 weeks, each time hoping for a diagnosis or cure for what she was feeling, but again, nothing has came up. Over the past 3 years, I had convinced myself that I have ovarian cancer, breast cancer, leukemia, nasal cancer, and lymphoma. Every day she wakes up and checks herself for any new sensations, lumps, or marks on her skin. This is an ongoing burden that she has to live with. At the end of the article, she says, when it comes to the public perception of health anxiety, I wish people knew that this is a crippling mental illness. She goes on by saying, someone with health anxiety, fear completely takes over and stops you from living your life. Hypochondriacs go through a vicious cycle, and it's so hard to break free from it. Thank you.